The positioning of an abdominoplasty patient after surgery is described here. You can see how our tummy tuck patient has a pillow underneath her knees, and she has 2 pillows behind the back. Again, what this does is it ensures that there's not too much tension on the lower abdominal incision, so that she's in a comfortable, relaxed type of position. And again, you can see, and I encourage all of my patients to make sure that they wiggle their toes, move their ankles, to make sure that they've got blood supply and blood flow in the lower extremities to make sure that they don't develop any type of clotting. When you have an abdominoplasty, if you do have to cough, and you will feel like you have to cough on occasion, either from the endotracheal tube, from the general anesthetic, or for whatever reason, you may be a little dry, you may be a little parched, it's important to take a pillow, wrap that around your belly, and hold that tight when you're doing your first cough. That will help alleviate some of the tension and some of the pressure off of the abdomen. Normally what we do is we place muscle sutures along the midline of the abdomen to tighten up the abdominal muscles, and plus you may have a small abdominal hernia as well that may have been corrected with the abdominal pannus or the abdominoplasty or the tummy tuck operation. Now, walking after an abdominoplasty or a tummy tuck or an abdominal pannus excision is essentially the same. Just think about it. You've removed a large segment of skin from the anterior wall of the abdomen. So there's naturally going to be tension there. We don't want you to stand up straight. We want you to walk with a little bit of a hunch. And you can do that for the first few days. Every single day as they go by, you'll find that you'll be able to be more erect in terms of standing every single day. But for the first couple of days, we want you to be sort of hunched over, a little bit like an older lady, walking, and just to make sure that you don't put too much tension on the wound. So with an abdominoplasty or even breast surgery, on occasion we use drains. Sometimes we don't use drains, sometimes we do use drains. It depends on your particular situation. If you do have a drain, that drain should be emptied once it reaches a certain level. If you find that it's full in the bulb, you should take it to the bathroom. You can do this on your own. You can just lift the small little cap on the bulb, empty the amount, record it. The most important thing is to make sure that you put it back on negative pressure. So you want to squeeze it so you get the air out and then put the cap back on. And if you've done it correctly, you'll see that the bulb will stay collapsed and it will stay on negative suction, which means that it's pulling out some of the excess fluid from underneath the abdominal wall.